Maria Kavallaris and I'm at the Children's Cancer Institute. What we've been able to do in the laboratory is actually develop a way to grow mini tumours in the laboratory in an environment that is very similar to what happens in the body. Now this is very exciting for us because it's a real challenge at the moment to do this. And what it means is we can use these tumours that we're growing in the laboratory, or the mini tumours in a dish, and we can do it in what we call a high throughput manner. So we can make like hundreds of them at once and then screen them to identify the best treatment for the individual patient. So it's really trying to find a way to personalise a treatment. So the advantages here is that one, you don't give a patient a treatment that's unlikely to work, so you're reducing toxicity, and two, that you're likely to find a treatment that has good chance of working in a patient. And if anything goes wrong and that patient doesn't respond or they relapse from treatment, we can go back and redo this type of testing again. So one of the big challenges in children's cancer, which is the #1 cause of disease-related death in children in Australia, is that when a child relapses from treatment or they don't respond to treatment, then the doctors have to treat them with high-dose chemotherapy that sometimes they don't know whether it's going to work or not. For us, the long-term impact of this research we're doing is to ultimately be able to develop a sort of diagnostic predictive tool for individual patients. So to personalise the treatment and do it in an accurate and rapid way so that we can give this information ultimately to the treating clinicians and the doctors so they can translate this to the clinic, so to their actual patients. So for me, seeing more children survive their disease, reduce toxicity by not giving them drugs that are not going to work, it will be the ultimate in 5 years' time. Look, for me, this is very personal, being able to work out better ways to identify the best treatments for patients. I'm personally a survivor of cancer. I had cancer when I was 21. I know about the toxic side effects of treatment, having experienced them firsthand. So being able to identify effective treatments that are going to work and hopefully won't be as toxic as well ultimately is something that really drives me and drives the research that I do. I want to say a big thank you to all the supporters that raise money for the Cancer Council to support the type of research we do. It makes a big difference for us to be able to get funding, to be able to find better ways to treat children with cancer and ultimately alleviate the impact for them and their families and let them survive a long life, which is ultimately what we want. And without their support, we could not be doing what we're doing.